In 2017-18, the Golden Jubilee carried out over 46,000 procedures, helping people who needed hip and knee replacements, cataracts, diagnostic imaging such as X-rays, CT scans and MRI scans. In addition, the Golden Jubilee carried out approximately 10,000 planned and emergency cardiothoracic and cardiology procedures within the treatment time guarantee. In total, 97% of patients were treated within the Scottish Government's treatment time guarantee, and 100% of cancer patients were treated within 31 days.
Welcome to the Golden Jubilee Foundation, and I hope you enjoy listening to the annual review of our performance for the last year. You know, we're a very unique national board because we serve patients from all over Scotland, and we do that by working closely with all boards, with academia and with our partners in industry. We want to fulfil our board statement of delivering quality research and innovation for as many people of Scotland as we possibly can. And to do that, we need to be the very best employer for our staff and to value them so that they will provide the highest quality of care for patients. So I hope you enjoy listening to the performance review of our last year.
Serving more than 5 million, the Golden Jubilee National Hospital is one of the largest heart and lung centres in Europe. In 2017-18, the Golden Jubilee National Hospital team performed 11 cardiac transplantation with excellent clinical outcome. We acquired organ retrieval system, which is the system that allows the donated heart to be transported while warm and beating to allow the surgeon to implant a good heart into the recipient. We're also a leading center for video-assisted thoracic surgery. We have recently acquired a robot which supports the robot-assisted thoracic surgery as a leading center for this service in Scotland. I'm proud to announce that the Golden Jubilee National Hospital has performed its first transcatheter aortic valve implantation, or TAVI, in April 2018 with excellent outcome. With all these services on board, the Golden Jubilee National Hospital, not surprisingly, being looked at as a role model and an excellent service delivery centre for the entire Scottish population.
As one of Europe's largest and best known elective orthopaedic hospitals, the Golden Jubilee are carrying out more than 25% of all hip and knee replacements in Scotland. That's helping every single health board in Scotland. The use of video conferencing for hip and knee replacement follow-up appointments for patients in rural areas and island boards is helping significantly reduce avoidable cancellations and unnecessary travel. Over the past 3 years, the Golden Jubilee has experienced an increasing demand for hip and knee revision surgery. Between 2016 and 18, demand for revisions has increased by 59%.
I'm Ali Gibson and I came in for a revision on a knee op that I'd had previously a few months earlier in Dumfries. I thought I was really well looked after at Dumfries and then I came here and it's like I actually sat here the other day thinking I was really blessed to be, the fact that I've got to stay in so long now, I'm so well looked after. People really go the extra mile and I'm just bowled over really.
There is an ongoing commitment to support the development of robotic assisted surgery. Precision robotic surgery should reduce patient recovery time, infection rates and enhance their experience with the replacement.
Our ophthalmology service continues to expand and is one of Scotland's largest units, treating around 18 to 20% of all cataract services in Scotland. In order to treat more patients and maintain excellent quality service, the Golden Jubilee has challenged and developed new ways of working. For example, optometrists have been recruited to see new patients in clinic, which releases consultants to spend more time in theatre. Nurses are being upskilled in theatre to undertake additional time to release surgeons in order to increase productivity. Currently, consultants are working across 2 theatres at the one time. This allows them to increase volume capacity within the ophthalmology service at the Golden Jubilee National Hospital.
In 2015, the Scottish Government announced ambitious plans to expand key elective specialties. This involves significant expansion of services here at the Golden Jubilee National Hospital. During the last year, additional diagnostic capacity has also been realised here at the hospital, with 2 additional MRI scanners being installed, which will benefit over 11,000 patients every year. Also in the last year, significant work has been undertaken in the planning of the new ophthalmology unit. Building work will commence in early 2019. The unit will have sufficient capacity to meet the needs of the West of Scotland population between now and 2035 and will open in a phased approach. By 2035, the unit will see over 11,000 additional new outpatients and have the capacity to undertake over 10,500 additional cataract procedures. This represents over a 225% increase in ophthalmology activity here at the Golden Jubilee. We're currently developing our outline business case for our Phase 2 expansion, with patients being able to access the expanded services by the end of 2021.
At the Golden Jubilee, we currently have 17 patient areas and 13 theatres actively working on Scottish Patient Safety Programme improvements. We have developed a unit with a specific focus of providing safe, high-quality, enhanced monitoring care to orthopaedic patients. This has the effect of reducing the need for pre-operative referrals to our high-dependency unit. Turning to the control and prevention of infection, last year we had a total of 11 Staphylococcus aureus bacteremias, which is below the national target of 0.24. At the Golden Jubilee, we also had 2 cases of Clostridium difficile infection, also known as C. diff, and this is below local and national targets. In addition, our levels of adverse events reduced compared to the same period last year. "96% of inpatients said their experience of the Golden Jubilee was positive. One of the most popular ways for people to interact with us is through social media. Currently, 99% of this engagement is positive. The most heartening for us to hear is that 96% of ophthalmology patients agree or strongly agree that they would recommend the service to their friends and family. And 94% of ophthalmology patients and 97% of orthopaedic patients agree or strongly agree that it's worth travelling to the Golden Jubilee for their treatment."
How would you rate the quality of the treatment and care that you've received in the Golden Jubilee?
Excellent.
You've been very happy with what's happened.
Everything's been explained.
In 2017-18, we had 82 complaints. This was a rise from the previous year. Our expansion programme aspires to make a positive social and economic impact, particularly within the Western Berkshire area. It aims to do this by maximising employment, training and business opportunities while supporting education activities through the development of the project. A community benefits plan is in place, and in addition, the board is working closely with partners such as West College Scotland to provide additional community benefits and learning opportunities for students.
Supporting and valuing our staff is one of the Golden Jubilee Foundation's core values. Over the last year, we've demonstrated our commitment to staff. We've become a disability confident leader. For the 4th consecutive year, we're in the Stonewall Top 100 Employers list. It's the year of the young person this year in Scotland. So this year we've actually become investors in young people and acquired a gold status, and that's demonstrating our commitment to our younger workforce. In the last year also we've received a gold award for our commitment to support reservists and the armed forces. We've been very pleased over the last couple of years around how we've supported I Matter within the organisation. I Matter is a staff questionnaire that basically staff feedback and how they feel they're being supported within the organisation, how they're treated. We continue to support the wellbeing of our staff through exercise classes, we've got staff physio service, which is used by a lot of staff, yoga classes. So our focus is really around staff wellbeing at the moment in the organisation, recognising if we maintain our staff wellbeing, then it has an impact on patient care and actually makes the staff much happier when they're in the workplace. Over the last year, we've seen the values-based recruitments programme that we've developed within the organisation being rolled out across NHS Scotland. It's now being used for all appointments to Executive Director and Non-Executive Director posts in the NHS in Scotland.
In 2017-18, we achieved our 3 core financial targets. Revenue achieved break-even position. Our capital spend was against budget, and we delivered more efficiency savings than we had planned.
I'm Catherine Sinclair and I'm Research Manager for the Golden Jubilee Foundation. I've been here for about 11 years now, and just to give you an idea of how things have expanded in that time, in the first year I was here we approved about 7 research projects, and then in the last financial year we approved 45.
We have quite an exciting new technology that we're using here in the Jubilee. This is the first time it's been used in Scotland, and it's a device called CardioMEMS. Now, this is a device that's CE marked. It's a device that's available in the United States of America, but this device unfortunately is not freely available to patients on the NHS. It's currently being evaluated by a study called the COAST study, and this is to hopefully prove that this type of device can be very useful in improving the management of patients with heart failure. And what I mean by that is largely keeping them out of hospital, making them feel less breathless.
We have a recent development of what's called a motion analysis lab, and that's a lab that allows our orthopaedic colleagues to look at the success of interventions that happen during orthopaedic surgery. So for example, a new or a different knee implant or hip implant, or a new way of implanting hips or knees, that sort of thing. So the motion analysis lab is a state-of-the-art outcome measure for orthopaedic research.
In this facility here, we can actually create a biomechanical model of our patients performing activities of daily living, for example, rising out of a chair. The benefit to the patient is that we can then use this as a tool to ensure that they get the best possible rehabilitation from that, to bring them back to as close as a healthy individual as we possibly can.
The Golden Jubilee Conference Hotel continues to deliver a conference centre of excellence for NHS Scotland and the wider public sector in Scotland. You know, we've got 15 great meeting spaces, 168 bedrooms, and we like to think we're the home of NHS Scotland events. And the Golden Jubilee Conference Hotel provides an essential service to the Golden Jubilee National Hospital, enabling a huge number of elective services, including the transplant service, day of surgery admission, over 8,000 rooms a year in fact. In addition to that, we provide about 3,000 rooms for patients' relatives. Our staff are hugely committed to delivering excellent service. This year we won the fantastic accolade from the Scottish Hotel Awards as Scotland's Conference Hotel of the Year for 2018, so we're really, really proud of that.
So as you can see, we're going to be very busy in the coming years with our expansion and with sharing our model of good practice across the rest of Scotland and indeed further afield. And that's really what we want to do. We want to be able to share the really positive work that happens here at the Golden Jubilee. What I see when I walk around this hospital is people smiling when they're at their work, patients smiling when they're in hospital, people getting the very best of care. We want everybody who comes here to feel loved and cared for, to feel compassion, and to go home feeling that they're able to go back to life and pick up where they left off but in a much better way because they're feeling much better and they're able to cope a lot better with their own situation. So that's what we're all about here at the Golden Jubilee, helping people, helping staff to be happy at work and contributing in a really positive way to the whole of the NHS.